Dr. Gabriela Tavares, who is the consultant at the Department of Respiratory Diseases and Chronic Conditions at the Ministry of Health in Brazil, the National TB program, and she's representing the General Coordinator, Denise Aracaki. And she will share with us the experiences of scaling up TPT in Brazil. Thank you.
So, good afternoon, everyone. First of all, I'd like to thank you for this opportunity. It is a pleasure for us to be here representing Brazil. And I have been working in the National Tuberculosis Program in Brazil since 2017 as a focal point for LTBI and TB-HIV co-infection. Today, I will show you some of activities that Brazil has been developing in LTBI and TB prevention in people living with HIV. In 2017, the NTP launched the national plan for end TB as a public health problem in Brazil. And it was based on the global goals and pillars and targets about the NTB strategy. And this national plan guides the development of TB actions, both in the national level for NTP activities, also in the local settings, for example, in the states and the municipalities too. And considering the theme of this session, it's important to emphasize that the Pillar 1 of this plan strongly recommends the intensify of collaborative TB-HIV activities and actions prevention. And about the actions prevent, more than a half are related to LTBI, as you can see, which showing the importance that Brazil has given in this theme and this matter from LTBI and people living with HIV. So bring it to the discussion. I show you some briefing historical process of LTBI in Brazil. The first recommendation for the treatment starts in 1997 with isoniazid regime. And in 2014, the NTP launched a note, information note, recommending the notification and follow-up of people under LTBI treatment in Brazil. In 2016, we started to recommendation the treatment with rifampicin for LTBI treatment. And in 2017, in response to one of the actions of the plan, the national plan of NTB in Brazil, we published the protocol of surveillance of LTBI in Brazil. And we initiated the implementation of surveillance system in the country. In 2018, in a joint collaboration with the HIV program and NTP, we published a joint note recommendation for LTBI treatment in people living with HIV with CD4 less than or equal 350, regardless the TST or IGRA findings. And today I would like to emphasize and to highlight the implementation of the LTBI surveillance in Brazil because it's an action that led to change the matter in Brazil and has an impact in the LTBI data that we have been before. Until 2018, in Brazil, it's not possible to trace the epidemiological profile of LTBI in the country because the states, the data collection by the states was so inconsistent and heterogeneous. We could not trace this epidemiological profile. So, with this, despite this, we implemented the national online system that is an easier system and is an online system to get data more consistent and with more information. And in this system, all people starting LTBI treatment should be registered and the NTP program and the TB programs of settings can monitoring and evaluation day by day the cases that initiation the treatment. Here is the face, is the face of the system, and for the implementation process in Brazil, for the system, the NTP team performed video conferences to explain about the system and to understand the local flows of surveillance. Later, we conduct on-site training about the use of the system and about the clinical management issues of LTBI-2. What we have noticed in this local setting training is a persistence of myths and opposition of some health professionals regard to the LTBI treatment. At this moment, now we took opportunity to change this mentality and to emphasize the importance of LTBI for TB control for all these professionals and for the managers of TB and HIV programs too. The system has now been implemented in 16 of 27 states of Brazil, as you can see in green. In yellow, we have 3 states that have already performed the video conference, but have not yet had the on-site training that had scheduled for the middle of the 2nd semester of this year. And in orange, we have states that have not scheduled the video conference yet. And in red, 2 states that already had the LTBI on system. We need to see how we can make a linkage before we implementation the system across the country with these 2 states. And in the first analysis of these data, from the beginning of December 2017 until July 2019, there were 7,782 people in treatment for TB, LTBI in the system, as you can see on the left. Of these, 49 are women and 33 male. Regarding HIV status on the right side, you can see that 3 people on treatment are people living with HIV in our system until now. It's important to emphasize that people living with HIV are one of the target population currently included for LTBI treatment indication in Brazil. And in our protocol, there are 5 types of indication for this population specifically. And now, today I'd like to emphasize and to highlight the last 2, people living with HIV with CD4 less than 350 and more than 350. That are the higher number of treatments in people living with HIV in Brazil today. So throughout this process, it's essential to highlight the relevance to work together with the HIV program and NTP, emphasizing the importance of LTBI in this population and in the surveillance of LTBI too. And right now in Brazil, we are working together, more together than ever, because we are in the same department. And we think this will be great for both programs that can be able to implement the collaborative actions with more emphasis in Brazil now. This was the joint note. Here, this was the joint note that we published in Brazil, stimulating the initiative of treatment of LTBI and of the importance of preventive TB in people living with HIV, mainly regard the mortality associated with TB in people living with HIV. It's a joint note between HIV program and NTP program. And we published it in the last year in 2018. With this note culminates in the incorporation of the variable of distribution of isoniazid 300 milligrams in the HIV system of distribution in Brazil, of distribution medicines and drugs for people living with HIV. This system is called Cyclone in Brazil, and now it has the variable regarding the distribution of isoniazid for LTBI treatment in people living with HIV. For this distribution, we made a joint analysis too with a coordination action, and as you can see, the distribution has grown up and with a peak, a great peak, and we are thinking about of the implementation of this new system and of the collaborative actions that we have been done with more emphasis in the last years and months. Today, 6,404 people living with HIV are in LTBI treatment with isoniazid 300 milligrams, distributed by specialized health services from HIV in Brazil. And to finally, as main challenges that we need to complete and finalize the implementation of this LTBI surveillance system, and we expect to finalize it by the end of the first semester of 2020. Incorporating new LTBI regimes as rifampicin 3-HP and 1-HP. We have some studies ongoing in partnership with UNITAID and Johns Hopkins University, as Jason has presented before. And incorporation new LTBI diagnosis test as IGRA, that is in our council technology for incorporation in SUS, that is our health universal system. And finally, to promote the scale-up of contact investigation and LTBI screening among target populations, like people living with HIV, but in addition, other target populations too. So thank you for your attention, and this is this.